A brief celebration amid all the sickness and death. 12 Ebola survivors are released from the government-run Elwa 2 treatment unit. Deputy Health Minister Tolbert Ninsua says they are making progress every day in Monrovia. But
the fact is that transmission is still going on. I am not saying that transmission has been broken. No, I cannot deceive the world.
Liberia must outflank the virus. Health volunteers have started doing rounds in the West Point shantytown. They don't use the word Ebola.
Okay, we are here on health matters. We want to know as to whether you have any sick person, somebody suffering from malaria, fever, typhoid, pressure, any of that thing. No one is sick. All the children well?
It's the height of the malaria and typhoid season, and those people need care. But Ebola also has similar symptoms. Suspected cases must be found and taken to isolation.
None of the children sick. No.
The team hears there may be someone sick near the mosque, so they head that way. Is anyone sick here, they ask. Has anyone died recently?
Yeah, nobody died yet. Recently, we'll let you people know. We won't have no patient here. I'm not talking about patient per se. Those who are experiencing malaria, fever, headache, shopping. Okay, these are things, information we want.
2 houses away, there's a sick girl. She's had fever and vomiting. They add her to their list. They say a response team will follow up, but no one seems to know who will come or when. Back at the area's health center, the waiting room is near empty. Staff say people are scared to come, scared it may be contaminated or that they may be taken to isolation. Contact tracers deliver their reports. They've just visited about 150 people related to 30 suspected Ebola victims. Supervisor Marie Hiding says these daily follow-ups are chipping away at resistance.
Because when you see somebody going to your house every day, oh, how are you coming on? Are you sick today? No. And they will be happy to see us because they will know that we are care for them and we are concerned.
The government lifted the quarantine on West Point on August 30th. Authorities barricaded the area after a mob attacked this holding center for suspected Ebola patients on August 17th. The quarantine led to panic and was criticized as counterproductive. Government spokesman Louis Brown defends it.
There was a level of denial that needed in our mind shock therapy. People needed to be sort of awakened to the fact that, look, this is deadly and it is serious. And this is no hanky-panky business.
But as resistance fades, another challenge is amplified. Where can sick people go? Ebola treatment units in the capital are full. Doctors Without Borders is expanding this unit to add 280 beds. Other agencies are building 5 more units to open later this month. Ann Look, VOA News, Monrovia.